Hi, this is Dr. Doug Willen. In today's video, I'm going to discuss how iodine needs to be in your diet if you have low thyroid. And you can either take it through supplementation or make sure you're getting it in your everyday foods. Towards the end of the video, I'm going to put a list of everyday foods that you'll probably recognize that you can make sure you try to incorporate into your diet. I also happen to make a thyroid supplement that I'll mention at the end. It's also in the description below. For some people, especially if they don't like seafood, that's another way to get it into your diet. But let's jump in. I have some good info. First of all, iodine is an essential mineral commonly found in seafood. It also has other sources, which we'll show at the very end. But your thyroid gland uses it specifically to make thyroid hormones. Now, if you looked at any of my past videos on thyroid, and you might want to look back at them, but your thyroid is a gland right here, and that's makes your thyroid hormone, which helps control growth, repair damaged cells, and supports a healthy metabolism. Some of the people that are vulnerable to iodine deficiency would be pregnant women. Women need more iodine when they're pregnant than when they're not pregnant. People who live in countries where there is very little iodine in the soil. So this would include South Asia, Southeast Asia, New Zealand, and European countries. There's some people that their everyday salt that they offer in their grocery stores, or at their restaurants, or in their home are not iodized salt. So if you live in a country like that, you might at least keep an eye on your thyroid, see how it's doing, make sure you have a healthy thyroid. People who follow a vegetarian or vegan diet are sometimes susceptible to their thyroid becoming a little out of balance. And again, knowing that, keep an eye on it. Look at your blood work, hopefully on a yearly basis. Work with your medical doctor and make sure you're getting your thyroid checked, especially if you have some of the symptoms that I mentioned in this video and also previous videos on thyroid specifically. But this is more of a iodine viewpoint as it relates to thyroid, as opposed to just being a video strictly on thyroid function, thyroid symptoms. Let's move on. So some of the symptoms, I think I have 10 of them here. You can count, let me know in the comment section, because I didn't count. I just started putting up the videos. But especially in countries that are more vulnerable to this, like, as I said, South Asia, Southeast Asia, parts of Europe, you could see something. We don't see it that much here in the United States, although there are cases, especially in extreme severe hypothyroidism. But you'll see a swelling here. Now, if someone is morbidly obese, you might not notice it because they're already thick in the neck. But when you palpate here, you'll feel a boggy, spongy feeling when you're beginning to get a goiter. And it can actually be like a sac or like a big, thick ball right there. And swelling in the front of the neck or a goiter is a common symptom of an iodine deficiency, and occurs when your thyroid gland is forced to make thyroid hormones when there is a low supply of iodine in the body. So if you don't have the right amount of iodine in the body, your body tends to get hypertrophy here in that excessive tissue, and that is a telltale sign. Like I said, we don't see that here in my practice. I think I've only seen one case in 20 years. But worldwide, it is more prevalent, and it's something at least to keep your eye on. And even in this country, you'll feel a little spongy here. It won't turn into a gigantic goiter, but you'll feel a little bogginess or swelling either on one or both lobes. So again, something to share with your medical doctor when you go in, if you do feel, when you palpate your own neck, that there is a little bit of a squishy, boggy feeling. One of the things that we do see here in the United States, as well as all around the world, when your thyroid is out or you're susceptible to iodine deficiency, is unexpected weight gain. So if you say, hey, as an adult, I've been averaging this amount of kilograms or pounds, depending on how you measure it, and in the last year or two, it really jumped to a different plateau. Of course, that could be from a numerous amount of things, so I'm not just saying that could be iodine deficiency or thyroid, but it's worth checking into, especially if you're suspicious. You watch this video, like I said, you watch one of my other videos that specifically goes over symptoms, and you might start to put together your own detective work that leads you to conclusion that you at least want to get your blood work done. Low iodine levels may slow your metabolism, encourage food to be stored as fat rather than be burned as energy. This may lead to weight gain. And, a lot of symptoms are prevalent in many different types of medical and health conditions and even disease conditions. So it's hard to do this detective work, but very often you're the one that brings it to your doctor's attention because you come in and say, hey, I've been doing some reading, doing some studying. I've noticed I have 5 or 8 of these symptoms that a lot of people with low thyroid have or iodine deficiency have. Can we test? Can we go to the next step? And that's all I'm saying. I'm an advocate of information, learning, and also championing your own health journey and not just be subject to hoping someone spots something for you. It never hurts to look out for yourself and be an advocate for your own journey. So let's go to the next one. Fatigue and weakness is another common symptom. And like I said, that could be on almost every other list of not feeling well, right? You could have chronic fatigue syndrome, you could have a cold, a flu, you could be depressed. So fatigue fits in so many different sequences. But again, it's in this one, so we have to include it. Low iodine levels may leave you feeling tired, sluggish, and weak. And this is because your body needs the mineral to make the energy. Let's move on. Hair loss. Iodine deficiency may prevent hair follicles from regenerating. Fortunately, getting sufficient iodine can correct hair loss that occurs, but this is hair loss that occurs due to iodine deficiency. I know you're probably going, hey, what's with that guy? He's got no hair or losing hair rapidly. And that's true, but mine is more of the hereditary male pattern baldness, alopecia, because of my genetics. And it's not because I don't even take my own thyroid supplement, which I do, because it really helps my energy levels and helps mental acuity, but it's not going to be enough because I'm not actually iodine deficient. And that at least is not the reason for my alopecia is from iodine deficiency. Very often in women that are losing hair is where this does come into play. That a woman in her 40s or 50s is now losing an awful lot of hair. And she doesn't have male pattern baldness for obvious reasons, but it's coming more from a metabolic reason. And sometimes her thyroid could be off. It could also come from toxicity in her food, air, and water. Many different things are worth exploring, but iodine deficiency might be one of them for a woman that's experiencing alopecia or hair loss. So just another on the list that we wanted to go over. So here's another one, dry, flaky skin. So people who feel that their skin quality has changed, it's dry, scaly, flaky, almost hurts sometimes. You're putting on more than your fair share of body cream, and it seems no matter how much you put on, your skin is like a dry riverbed. Dry, flaky skin may occur with iodine deficiency as the mineral helps your skin cells regenerate. Listen to that. This mineral can literally help your skin cells regenerate. So when it's deficiency, you're not getting that turnover of fresh, beautiful skin cells because skin sloughs off and comes back and sloughs off and comes back. And depending on the food that you eat and the way you take care of your body on the inside is a lot of the way we'll see how your skin is expressing itself on the outside. So I always tell my patients that skin, for the most part, is not all the expensive lotions and potions that you put on the outside. Skin is an inside game. And remember that because if you're really looking for long-lasting changes with your skin, look to the inside. See how you're eating. See if you can improve the ingredients that you put in your body and also balance your glandular system, your digestive system, your endocrine system, and make a difference from the inside out. And that's how you get long-lasting changes. Or at least bring your health to the highest potential at each age group. So when you're 20, you want to be a healthy 20-year-old. When you're a 30-year-old, you want to be the healthiest 30-year-old you can be. When you're 40, 50, 60, 70, 80, 90 years old, at least be the 90-year-old that expresses their health at the highest level. Dry, flaky skin may occur with iodine deficiency as this mineral helps your skin cell regenerate. Remember that. Feeling colder than usual. So that's that body temperature. If you're the type of person that feels cold all the time, you're in a restaurant, I don't know if we're going to restaurants too much anymore during this COVID problem, but if you're the type that, every time you're out with people, you're the one reaching for a sweater, or even in your own home, you feel like you're cold all the time, or your toes are cold, your nose is cold, the tip of your glutes are cold, you're the type of person that gets cold, you might look at iodine deficiency or low thyroid as part of the problem. Iodine helps the body generate heat, so low levels of it may leave you feeling colder than usual. Heart rate is another one. Changes in heart rate. An iodine deficiency may slow your heart rate, which may leave you feeling weak, fatigued, dizzy, and at risk of fainting. It actually gives you bradycardia, which is slower heart rate, as opposed to tachycardia, which is a higher heart rate. And again, these are more medical concerns, so this is just clues that you gather, you write them down on a piece of paper next time you see your medical doctor, or make an appointment to see your medical doctor and bring these subjects up, because if nothing else, your medical doctor might say, hey, let's run some lab work. And that never hurts to have the information. Then how you decide to react to that lab work is a personal choice, but I like having info. Memory, trouble learning and remembering. So when you're low in iodine, you're going to feel mentally sluggish. You're not going to have that sharp mental acuity that you're accustomed to. It's going to be harder for you to learn, harder to remember things. You're going to be forgetting things a lot. An iodine deficiency at any age, whether you're a child, a college student, in your adult years, or even your senior years, may cause you to struggle to learn and remember things. And this could also really help or lead to the brain not functioning at its highest level. So as we all know, the brain is something we really need to take good care of. And iodine deficiency is a concern, even though it's not a high percentile concern. If it is your one that strikes, meaning that if you're the one that shows up with that type of deficiency, it would be a grand concern for you. So when women are pregnant, getting enough iodine is especially important during pregnancy and breastfeeding. So after she gives birth and she's breastfeeding, is that there's going to be higher needs for iodine. And iodine deficiency may cause severe side effects, especially for the baby, such as stunted growth and brain development. We're back to brain development. So make sure that you're keeping your thyroid at least checked out during your pregnancy, or if you're planning on getting pregnant, that might be something on your to-do list, is to see how that's functioning. If you're the type of person that's getting heavy or irregular periods, of course I'm talking to women right now, some women with an iodine deficiency may experience heavy, irregular menstrual flow. Sometimes it's very thick or clotty. It's just not what you expect. So you go through a phase like that and start to look at some of the other symptoms that I put into this video on the list, or go back and look at some of my low thyroid videos and see if you're starting to collect enough symptoms to warrant some blood work. Go get some blood work, see where you really stand. Remember, when you get blood work, you can easily just go on any prescription drug that your doctor offers. You could also do a trial period on something natural, see if that works. Work with your doctor, don't work against your doctor, and say, hey, what if you give me 1 month or 2 months and then we recheck my blood work? You go on something natural, and if it's not doing the trick, of course, escalate and go up the ladder if you need to. I'm not saying not to. But many of my patients, a high percentage, 70, 80%, unless they have severe hypothyroidism, are able to effectively, efficiently, and safely balance their thyroid on natural products. They are still getting lab work done, so they're not doing it recklessly. Every 2 or 3 months, they make sure that their thyroid is in their zone and being healthy and safe. And as long as they can prove that and bring in the empirical data to their medical doctor and show that they're able to balance it naturally, there's no harm, no foul, everybody's happy. But if you still continue to, let's say, take a natural supplement, even my supplement, and you can't balance your thyroid, that's a concern. That would be a concern for me, so that if you were my patient, I would probably tell you at that point, listen, we've done a lot. We've looked at your diet, we've looked at other patterns, we've looked at the cascade of other hormones in your body, we've looked at your lab work, and you're not making a change. I probably would refer you out to a good endocrinologist at that point, because I can't look you in the eye and feel like I'm doing a good job for you if I leave you out of balance and you're not getting to a place where your health is at its highest level. Here's some sources that I promised. So natural sources, if you don't want to take supplements, but you think you can really go at this naturally. Seaweed. So, there's different forms of this, especially if you go to your health food store, but you get a sheet of dry seaweed, and that has, depending on the potency of it, you might get your recommended daily amount through that. Eating deep sea fish like cod, even 3 ounces of cod, 85 grams, will bring 66% of the RDI for iodine. Yogurt, a plain cup of yogurt has iodine in it. Iodized salt, shrimp, egg, tuna. You can read the list. Let's move on. I have always had thyroid supplements in my office for the last 20 years. I only started making my own supplement about 2 years ago. So there's a lot of good companies out there. I like my brand, but I like other brands too. There's so many good companies that make a quality, high quality product. So look for ones that your friends use, your loved ones. Do some research. About 2 years ago, I started formulating my own because I know specifically what I wanted my patients to have. Plus, with my own, I can test, retest, and check on it. And I did come up with a formula that tests well. So when we recheck them, their lab work looks great. And it doesn't work for every single person, but it has a high effective and success rate. And so that's what it looks like, or that's our new label. Look, it's got a picture of me on it. Can't be all that bad. And please subscribe and leave a comment below. I hope you're enjoying my videos, and have a great day. Thanks.